Isang maganda at mainit na pagbati po sa ating mga participants this morning. Special thank you to the Philippine College of Surgeons. I'm a co-fellow. I'm also a fellow and a member of the Philippine College of Surgeons. Of course, I'd like to give thanks to Dr. Roel De Leon, the president of the PCS, Mayor Joy Belmonte of Quezon City, the Honorable Senator Risa Ontiveros, who's I think coming over in a little while, Assistant Secretary Lilian De Leon, who just gave her speech, Dr. Corazon Ngelangel, President of the Philippine Cancer Society, the Board of Directors and members of the Philippine College of Surgeons and the Philippine Cancer Society, the NICA Council members, our members or partners from the various civil society organizations, distinguished guests, colleagues, and friends. Special mention to Melissa De Leon, one of our spokesperson cancer survivors. Magandang umaga po sa inyong lahat. So I will go through the commitments of PhilHealth. As we all know, cancer is one of the leading causes of mortality and morbidity in our country. What we're trying to do is be more specific and dedicated to covering cases that will really impact the lives of Filipinos. So an across the board has been done in the previous start of the year at 50% and 30% previously, February 14 of 2024. But we will be doing prospectively a multifactorial study on what causes the most out-of-pocket expense, what is the most prevalent, what with the current standard of care and treatment produces the biggest or the greatest outcome. So that is what we call the targeted choice of what to be covering. And definitely cancer is going to be one and front and center of these cases. So we all know that the total number of cases in the Philippines is almost 118,976 or 1%. A bit more than the population, but the death toll is really very high. So we are looking at ways on how to at least detect cancer early and be able to prevent the progression. So that's why we're looking at really covering the whole continuity of care. For the preventive aspect, we have to identify the gap, and this we will do with the Department of Health. Early detection is now going to be incorporated into Consulta. Consulta is a primary care platform where we will add, apart from the capitation for most common disease, some what we call siloed programs. So it's going to be a hybrid. It's not going to be fully capitated because at this point we know we have to have data to determine how much really it needs on a per member per year capitation to cover all the preventive aspects of healthcare. But specific to cancer will be early detection, which means we will enhance and increase outpatient laboratory procedures. So we all know that there's now an OPD-ER benefit package. Although it's on a fixed rate per specific lab tests, we hope that it's not going to be abused. Kasi without coverage of the outpatient OPD laboratory, obviously, people will go to the ER and say, oh, I have a severe back pain, do an MRI for me. So we hope coverage of our outpatient laboratory through the Consulta will somehow mitigate that. Because the out-of-pocket or copay for ER will be bigger than if you go to a Consulta primary care provider. Diagnosis, there are questions. Will we already go to molecular and to all the different newer technology in predicting and also in identifying potential factors for progression? I think that is a question to be asked of the HTAC or the Health Technology Advisory Council, because once they say it is cost-effective and it is evidence-based, then definitely PhilHealth will follow and cover it. But for now, we're looking at initially the basic outpatient procedures, which are mammograms, your pap smears, your ultrasounds, your MRIs, your CT scans. And definitely management will be covered further with the Z package. And we're also looking at palliative care and end-of-life care. So that's the whole cycle or continuity of care for cancer. Also recovery for those who are favorably respond to treatment. So what are the Z benefits? These are contracted out services to specific hospitals that currently has, number one, the capacity by virtue of their specialty, slew of specialty doctors, and also the equipment. So it's unlike a case rate, where a case rate is usually applied throughout all the network of affiliated facilities. The Z package are specific to certain hospitals. So you can see here that the accredited provider is relatively few, but we aim to have at least one or two provider per region. So we're encouraging private sector. I just had a meeting with the Private Hospital Association and all the big networks initially, and they have committed to also affiliate the respective hospital to the Z package. The objective is for the Z package to be zero out of pocket, at least for ward patients. Obviously, if they offer higher accommodations, single room and direct access to whoever they want to consult with, there will be some co-payment attached to it. So right now we have 6 Z packages, regular Z packages, and then we are committed to enhance it with additional Z packages. Next. So apart from the Z package, we have now our case rates. So case rates are basically applicable or should be covered by all PhilHealth accredited hospitals. And there are 2 types. The ones are specific to the treatment of the disease, and you would see it here. And the other one is related to mostly chemotherapy and procedures to augment the treatment of the diseases. So chemotherapy and also central venous access, arterial catheterization are examples of these case rates related to cancers. But what do we have in store in the next years? We're still looking at cancer cares for oral head and neck, cervical, an enhancement of the existing cervical cancer package, gastric CA, Wilms tumor, palliative and end-of-life care for cancer patients, hypothyroidism and hyperthyroidism. And as you could see, this list of DOH-approved CPGs, I think we need to collaborate with the societies involved to really develop what is the standard of care. What is standard of care that is applicable in the Philippine setting, where most hospitals can now be affiliated to be able to offer this at a Z package rate. So we encourage the societies and institutions to engage with the DOH in developing quality CPGs, which will then serve as basis for the benefit development of PhilHealth. So what is PhilHealth's goal? I just recently launched our internal marching order, which is RISE 30. RISE 30 mission means in every 30 days, we should come up with significant benefits and also significant improvements in our procedures and services. So the cadence will be every 30 days in the next 30 months, because we just celebrated our 30th year. So our cadence is Rise to 30. There's always something new every 30 days at sama-samang pag-angat para sa bagong Pilipinas. So a lot of you are complaining, of course, the lengthy process of claims adjudication and filing. So I'm tasked to review the filing. Look for a news announcement hopefully by tomorrow regarding your denied claims. Hopefully we can also look at reprocessing your denied claims, especially those that are filed through your e-claims or e-filing, which started January 1, 2018. We're looking at zero backlog for our unpaid claims, and we endeavor to have the same measure one number, meaning we will really look at coming up with numbers that match with your hospitals and your institution's number. And we're looking at even emailing your respective CEOs, sans all the non-disclosure and data privacy aspect, so that we are on the same page as regards how much is pending claim, how much has been rejected, how much is RTH, etc., etc. But currently, we're studying the most common cause of denied claim, which is filing beyond your 60-day period. So I think there's a direction to relax it, but not to be abused. So which means you still have to push your filing clerks, push your doctors to accomplish the form such that the forms hopefully has minimal rejection rate. Pinakamahirap po yung papirmahan yung doktor, hinahabol lagi eh. So baka sabihin namin, baka yung DocuSign, pwede na natin gawin, di ba? Email sa inyo, i-approve nyo through your email or through your text para hindi na kayo hinahabol. And we are more, kumbaga, electronically connected. But what I would be asking from providers is the supply and demand mismatch. We're creating market. We're improving our packages. So please encourage your hospitals, if they're capable, to enroll in the Z package. The Z package is going to be hopefully more robust than the existing Z package. And precisely why we are asking help from you. Please provide us your CPGs, your standard of care, so we can adjust our Z packages. Another important thing that we are asking private sector to be involved with, although this is not written here, is the consulta. Because the consulta will be your first touch point. People who will be going to consulta will undergo what you call the first patient encounter, which is basically a case-finding exercise para people who have early-stage cancer, people who are predisposition to cancer, will be immediately screened or will be immediately diagnosed. So in summary, what are our asks? Our ask is to increase specialist training. We will put up Z packages all over the country, but if there are no manpower to man those Z centers or those facilities offering Z package, wala ring mangyayari. So we're also shifting to a DRG payment, which is different from all case rate. All case rates na today is just one package, and if you have comorbidities, you are paid according to the biggest disease, di ba? On the biggest RVU in terms of surgeons, or the biggest case rates for medical. In DRG, it's per episode of care. So if you have a fracture, for example, but you have comorbidities of a heart disease and a diabetes, and there's laterality, you have both left and right lower extremity, for example, involved, the DRG will already account for that. And there will be multipliers, modifiers, depending on situations. For example, you're in a remote area, you're the only cancer specialist or you're the only oncologist, then we will provide some provisions on the multiplier such that your DRG or your value payment will be a bit higher. Also, if you are in a training hospital where you have a lot of cases for clinical education, then we will factor the modifier to give a little bit of more assistance or coverage than the ordinary non-teaching hospitals. So that's the copay ceiling is very important kasi we're increasing our support value, yet the out-of-pocket of the patients for the doctors remain the same. Kasi most of the doctors would feel, I'm not too sure naman if PhilHealth will pay us, so hindi ko muna i-discount. This is a whole of nation approach po eh. Hindi pwedeng PhilHealth lang ang tumataya. Lahat tayo tataya. Lahat ng Pilipino may responsibilidad. So tayo bilang manggagamot, may responsibilidad tayo na sana naman kapag nag-increase kami ng support value, pakiusap lang, baba lang naman natin at i-deduct yung karagdagang support value ng PF in your respective PF para naman maramdaman ng ating mga pasyente at miyembro na talaga nag-i-impact na yung ating pag-increase ng health benefits. CPG development, which I've been enumerating and alluding to repeatedly, and the practice standard of care. So this will help us. We can collaborate with our group or the DOH in developing these CPGs and standard of care para magawa namin na naangkop at talagang applicable yung aming case rates at saka yung aming Z package. So what is the end goal? The end goal is for one PhilHealth na mabilis, patas, at mapagkakatiwalaan. So a PhilHealth that would really be responsive to the needs of our patients, to the needs of our members, to the needs of our providers, to make the Philippines a healthy Philippines such that bawat buhay ay mahalaga. Maraming salamat po at asahan ko po ang tulong niyo.